Hi Tappers! Today's story is quite dramatic and involves saving a woman's life that's on the brink of suicide. Please note this story is from a doctor who works with patients in deep and dire mental states, and what she explains should not be taken as instruction for someone without this training to attempt to use. It comes from Masha Bennett, who is an EFT instructor. A student of hers shared this experience with Masha, and Masha shared it with us. Masha says, "One of my students from Moscow, Dr. Oksana Korsanova, a psychiatrist and psychotherapist, shared the following story. Her 23-year-old female client, whom we will call Kate, began her therapy approximately 6 months after Oksana had learned the basics of EFT in the Level 1 workshop I taught in Moscow in 2008. Kate was a nurse, married for 2 years, to a man a year younger. At the commencement of therapy for depression, Kate was in the 3rd month of pregnancy. She said she felt no joy at the thought of her baby coming into the world, no joy in the relationship with her husband, and her outlook for the future was gloomy and hopeless. 3 years previously, she began receiving pharmacological treatment in the form of antidepressants and tranquilizers, but the doctors advised against psychotropic medicine during pregnancy, so she was referred for psychotherapy instead. Kate was absorbed by anxiety, low mood, and fears for her future, and had frequent suicidal thoughts. At that time, Dr. Korsanova had already begun to implement EFT in her therapy practice. She learned to identify the aspects of the problem, which she described as magician's handkerchiefs. Once you draw out the first one, it pulls out the second one, etc., and had found the movie technique extremely useful for the treatment of both old and fresh traumas. This was the first case for Oksana of working with a young suicidal patient who was pregnant, and she was treading carefully as she introduced EFT into the treatment alongside the traditional psychotherapy methods. Whilst some of Kate's distress eased during therapy, the relief turned out to only be temporary. The overwhelming feelings returned, and during one of the sessions, Kate told her therapist while weeping that she didn't think that therapy was working. She didn't want to be tormented anymore, and the thoughts of stopping all the suffering were coming to her mind more and more frequently. Concerned, Oksana gave the patient her mobile number with permission to call outside of office hours if she needed help. A few weeks after treatment began, Oksana received a call from her patient's husband. He said that Kate was standing on the balcony of their 8th floor apartment and wouldn't leave it. Just before going out on the balcony, she had been crying and pacing around the room for some time. Now she was standing, looking pale, serious, and determined, close to the balcony railing. "What should I do?" the husband asked. Oksana told him to pass the phone to Kate and asked her how she felt. She replied that she had been very low, anxious, and hopeless, and at that moment, she was looking at the clouds. She envied them. They seemed to be floating so easily, calmly, with no care in the world. They were free from anguish. Kate calmly noted that she wanted to float in the sky just as easily and freely as the clouds. She just needed to cross the balcony railing, and then everything would be fine. Oksana then asked Kate to describe the balcony where she was and her posture. She described her surroundings and said that she was leaning forward over the railings. Oksana asked her to move away a little from the railings and gently suggested that they do some tapping over the phone. Kate agreed, and they began to tap. Oksana was very conscious that the phrase of self-love, self-acceptance, or self-forgiveness and the setup statement would most likely be rejected by Kate at this time when she was seriously considering ending her life. So she had to be creative in the use of her language to start with. Oksana suggested the following words: "Even though I am standing on the balcony and I am watching the clouds floating past, I am standing on the balcony with both of my legs." She then double-checked with Kate, "Is this true? Are you sure that you are standing on the balcony with both of your legs?" Kate replied, "Yes, it is true, I am sure." They tapped on that phrase. Then Oksana asked, "Kate, are you alive now?" "Yes, I am alive." Would it be okay to say that even though you are standing on the balcony and envy the clouds, you are alive anyway? Yes, I can do that. Is it true? Yes, it is true. So they tapped on, even though I am standing on the balcony and I envy the clouds, I am alive anyway. They both continued tapping over the phone, Oksana in her office, Kate on the balcony of her 8th floor apartment. After a little while, Kate repeated with some emphasis and conviction in her voice, "Yes, I am alive." Oksana later found that that was the moment her client felt the determination to live. They continued tapping on phrases such as, "Though it hurts and I am scared, I am alive anyway. Though I feel anguished and weary, I am alive anyway." When they finished tapping, Kate said that now she had left the balcony and was sitting on the sofa in her living room, and she was tired. They said goodbye. An hour later, Kate's husband called and reported that his wife was sleeping. The next day, Kate got in touch to arrange another session. They continued working throughout the pregnancy using EFT as one of the central tools. There were some successes during treatment and some significant challenges as well. The depression abated slowly. In the later stages of pregnancy, the frequency of sessions diminished as Kate was beginning to enjoy the relationship with her husband and more eagerly awaiting the arrival of the new baby. Then one day she called her therapist and said, "I'm ringing from the hospital. I have just given birth to my son, and he is the most wonderful baby in the world." Even though I don't know Kate or her family, I am deeply moved and touched, knowing that there was a woman who was in so much pain and felt so helpless to get away from that pain that she ached to resolve it in the only way she knew how, and was able in a few months instead to feel the joy for her life, her husband, and her little baby. I also like this story, Tappers, because it highlights that Kate was receiving multiple forms of help. Sometimes there's a stigma attached to allowing oneself to receive help, and an even bigger stigma to receiving multiple forms of help. There's a lot of really great support and resource out there, EFT being a great one, but not the only one. I hope you are allowing yourself to get any help that you need. I'll see you soon.